think in 2002, I was I was found out that I have this problem, but not very high.
Okay. High sugar.
Yeah, high sugar,
Okay.
high blood sugar
High
level.
blood sugar.
So I ignore it.
Okay.
So
How you got to know?
I went to clinic.
You went to clinic.
To do a medical
Just
checkup.
general yearly checkup. Okay.
And then in 2006, diagnosed with high blood sugar also.
Okay.
And again, I ignored it.
Okay.
Because at that time I was doing wholesaling of fruits.
Okay.
So I have to taste the fruits.
Okay.
So I think because of that reason, my blood sugar is high.
Okay.
So I ignored it.
Okay. You think because just you're eating fruits? That's why
Okay. And then in 2012, I went to India.
Okay.
For meditation.
Meditation.
Yeah. And then my leg swelled.
Okay.
And because of the infection, so I was sent to hospital in India.
Okay. Suddenly your leg swelled.
No, before I went to India, I checked. My leg was swelled, but the doctor said nothing wrong with it. It's a normal swell.
Okay.
So I went.
Yeah.
So I went directly to India without doing further operation or other things. So I was sent to hospital in India.
And in India, it became worse.
Yeah, it became worse.
Okay.
And then I had high fever. So I stayed in the hospital for 5 days.
Okay.
They measure my blood sugar very high.
Okay.
They say even the meter cannot read. It's high until that level.
Okay.
So finally the doctor decided, asked me to come back to Malaysia to do operation.
Okay. What operation?
I mean, it's an infection. Something is inside the leg.
Okay.
So when you take out those
okay.
I think.
You got getting pain?
Yeah, pain. It's very painful.
Okay.
So, and in the hospital they have to inject me with insulin. I think 2 days. Wait until 2 days and then start the operation because the insulin, my blood sugar level is very high.
Too high.
So cannot do operation.
Okay.
So I think it's very high lah.
Okay.
And then after operation, then I start seeing doctor to check my sugar level every month. Okay. I take medicines for 1 or 2 years.
Okay.
But I found no. There are some improvement now.
Okay.
But I still find that no big improvement. And then I stopped taking the medicine.
This when you came back to Malaysia. You did the operation?
Yeah, I did operation.
Okay. Then they gave you medication. The medication for diabetes.
No, for diabetes.
Oh, diabetes. Okay.
For 2 years, I take the medicine for 2 years.
They ask you to do insulin also?
No insulin.
Just medication. Okay.
So 2 years later, I give up and then I don't want to take the medicine.
Why? What
because I see no big improvement.
No improvement. But then improvement means the sugar level.
Yeah.
You do the test regularly.
Yeah, I do the test regularly.
Okay.
It's almost the same.
Okay.
So
no change.
No change.
What's the point of taking medication? Okay.
And then every time I see the doctor, I think I can repeat her questions also.
Asking the same questions.
Asking the same questions, and I have the same answers.
Okay.
So I say, and no point to see and waste a lot of time. I have to wait a long time there.
Yes.
So I say I better don't go.
This is what, general clinic or hospital? Or?
It's a hospital.
Hospital. Okay. Then.
Then I think in the year of 2019.
Oh, many years you're taking the medication?
No, I took 2 years only.
2 years?
Until 2014.
Okay.
And then for 3, 4, 5 years I didn't take. On and off.
After 2012 you got operated, right?
Yeah. Okay. 2012 operated.
Then
took 2 years medicine.
Okay. Then didn't find any improvement. Then after that on and off. Okay. Then during that 2014 to 2019, you doing any visiting clinic or something?
Yeah.
Going still?
See some traditional doctors.
Okay. Trying to see any alternate solution? Okay.
So, but in the year of 2019, I found that my muscles start shrinking.
2019.
2019.
Okay.
So I say I have to do something with it lah.
Okay.
Cannot ignore it anymore. So I heard that Dr. Lee is a specialist in this area.
Okay.
So I came to see him. He explained all the causes of this high blood sugar.
High sugar. Okay.
The root cause.
Okay.
And then he explained some of the conditions that I have.
The other conditions.
Okay. Due to the high blood sugar.
Okay.
I think I start build out the trust in him.
Then whatever he explained to you, it makes sense to you.
Yeah, makes sense to me.
Okay. Then the first thing you did is you did the detox, is it?
Yes.
Is that the first thing you did? You did the detoxification. After the detox program, you any difference? And you started feeling better, or any improvement?
Yes, of course.
You started feeling an improvement. Okay.
Especially in terms of the energy.
Oh, you feel?
Yeah, I feel energetic. Yeah, it helps me to stay calm.
Okay.
And then you can more focus. Sometimes you don't, you are not disturbed by other things. You can be more focused.
Can be more focused.
Yeah, that time no
more cravings.
Yeah, no more cravings.
Lost the cravings.
Yeah.
What you were craving for?
Actually, it's you try to find something to eat.
Okay. Always want to
look for something to eat.
Put in your mouth. Okay, now I'm very stable.
Yeah, very stable.
Okay.
Actually, I used to drink coffee. I think more than 30 years every day I need to drink coffee.
Oh, okay.
2 or 3 cups.
It's 3 cups.
3 cups a day. It's like you must. To feel energy or something like that. Okay. And
then after the advice from the doctor, I can stop immediately.
Immediately you stop. And then no more craving. No addiction. You feel very achieved. You achieve something.
A big achievement.
Okay.
My sugar level is quite normal now.
Okay.
I think it's controllable.
Okay.
And then we know the root cause of causing high sugar level.
Okay. And what is that?
Okay, that is food is the most important.
Food, okay.
And secondly is exercise.
Okay. What was the difference? Now you say food is most important. When you went to Thailand, you said they also give you the diet plan. So what was different between what doctor explained?
But because at that time we didn't measure. We didn't measure and check with the food we take. Now we measure and then we check at the same time what foods we take.
Okay, so we
can see.
You know which food is affecting you.
Yes. We know exactly what is the cause of the high sugar level.
Okay.
Due to what food.
Okay.
What kinds of food you cannot take. You can take at what time.
Okay.
All those things.
Okay.
I have reached the retirement age. Okay. But I think that I actually my energy level. I think I can start a new business. And then I pick up, some of the hobbies I start taking back. Doing back. Like photographing.
Okay.
Music,
really?
Playing music.
Okay.
I have the energy to do those things.
Yes.
Last time I had better sleep.
Demotivated. So, a couple of things that helps the patient to get results. I'll highlight them to you, then you tell me how important it is, then you give me your opinion. Okay? The first thing is that they need to have a strong desire to get back their health. Is that a very important thing?
I think that is the most important thing.
Okay.
Otherwise, you just listen to doctor and then you don't know what is the doctor trying to do.
Yes.
You don't have the
force.
The force to follow. Now you know everything, the details, the root cause.
Yes.
Then you have automatically you have the desire to follow.
One of the main reasons a patient get result in Heal Within is many factors, but one critical factor is that they have the support of the family.
Yes.
You know, what importance did your wife's support in your treatment help you to achieve?
It's very important.
Okay.
She helps me to write down all the foods I eat.
Okay.
I measure myself, and then we can compare what kinds of food I eat, I should not eat, what kind of food I should not eat.
She's like
she prepare everything. Assistant.
Completely doing it with you. Okay.
And then every time, I take about 30 tablets every day. Every time, she prepare for me. She pick the tablet for me.
Okay, she'll do it for you. That's a real big help, huh?
And then she reminds me the time I need to take the medicine, the supplements.
She's equally committed with you.
Yeah. We both have commitment.
Oh. And what's your commitment? What was your driving force? Like, what do you want?
I want him to have long life.
Okay, so you want to have long life.
Yes.
Okay.
Be healthy.
Long time.
Yeah.
Okay.
Yes.
Okay. That is your main driving force.
Yes.
More than to stop the medication, is it?
Yeah.
Okay. Then he wants to stop the medication.
Yeah, because I know the medication got a lot of effects.
Okay, so we'll not help him.
Yes.
That is it's bothering you.
Yeah, I don't like the side effect. Maybe I have to take care of him.
Yes.
For when he getting old.
Yes.
That's why I want him to be healthy, and then we can just
stay together.
Long time.
Yeah, I think it's right. You mentioned that the children they don't have any burden because of my kids they are all overseas.
Okay.
So we don't want them to worry about our health.
About your health, yes.
So I think it's good to do something.
Definitely, you had your nurse, doctor to support you during your journey. Did it play an important role?
Yes.
Always follow up.
Okay, to follow up.
Yes.
See how you're doing. Follow the program without any questions.
Yes.
Was it you think without that Was it like a necessary thing? It helped you?
Yes.
Okay.
Because you see, you can see from their face, they have the confidence level.
Okay.
That make you trust them.
Okay.
When they are very friendly, smile, always
very helpful.
Very helpful.
And
it's very helpful.
Then they give you one thing doctor was telling me that he's very impressed with you. He's saying, 𝘾𝙤𝙖, oh my gosh, he's one of my best patients. He's saying he kept the record. He kept his health record. He take the every dailies, his food record. You already told me that. Which food is affecting you? Check your daily blood sugar level, etc., etc. Okay. How important is that for a patient to do so that they can help to get themselves? You think it's important? What made you do it?
It's important, otherwise you don't know your progress.
Okay.
And then you don't know whether you have improvement or not.
Okay.
So once you do that, not only that you learn from the things you record, but it also builds up your confidence level.
Okay.
You know that you are into the right direction.
Right direction.
Yeah, if you record, sometimes you come up with the same reading. Let's say after eating you should have a 8, but now suddenly you come out with a 12. Then you go back to the record to check. And then you find out what kinds of things affected your level.
Okay.
What kinds of food affected your levels.
Okay.
So the recording is very important.
Very important. It's something that you would advise any other patient who comes to you, but then you must do it.
Yes.
Okay. Okay. The next thing is that doctor was saying you're very engaged with him. In other words, you always ask him questions. You follow up with him. You're not like just easy, just following. Okay, but you're very engaged. What is it that caused you to be so engaged, ask him questions more, and then how important it is for a patient to do that to get the result?
Okay, our experience with other doctors, we don't. Those doctors, they don't let us know the root cause. Okay, and then some of the patients we ask, I think we don't have we don't want to ask also, because the reason given by them is what we ask. But here it's different. We ask, they give us the answer. So we know that of course I have 20 years of experience in high sugar level. But what is the root cause? I don't know much. So I have to ask a lot of questions. And then this is I think diabetes is a very complicated things. Not only that organs affect you, the hormones of the whole body affects you. So these are the things we don't have any knowledge. So we have to ask the doctor.
Okay. When you asked doctor, did it already empower you? You gained a lot of knowledge from it.
Yes.
You gained much more than knowledge. You got empowered knowledge how to take care of your own health also. You got much more out of this.
Yes.
Okay. It's like going to school already, paying the school fees also, right?
Yes.
Going to medical school, but the medical school that is easy for people like you and me to understand. Do you think it is necessary to be completely compliant with the doctor's plan, and why not to try to replace his products with something just to save cost? Do you think it's important?
Yeah, it's very important because we are not the expertise in this area. And then what are the ingredients in the formula? We don't know. So we cannot just simply change it to use other brands. Because some of the ingredients may be not inside. Although they have the same name, but some of the ingredients may not in their products. So we have to follow. Not only the ingredients, and then the percentage of those ingredients is also important. So because I think this is a tailor-made, because of the doctor prescribed it because of my body conditions. You cannot buy from any other places.
What would you tell somebody who has diabetes want to get a result? What would you tell them? The first thing, what would you tell them?
I think I'm the right person to tell them that, because I have so many years of experience. I mean the history in the and the experience in facing different doctors. And then I found that if you go to the normal clinics or normal hospital, they'll give you the same answer to take medicines. And then one day you find that if the medicine is not enough, you may need to take insulins. But these are the things we can avoid. We can avoid that by using this kind of treatment, going for this kind of treatment. Then you can cut down a lot of unnecessary expenses. And then the most important is the time. You don't waste your time. I have wasted almost 20 years.
You said you can cut down your expenses. Please explain to me what you mean by that.
What I mean is, you see that it's not only the medicine, the cost of the medicines. The most important is the time, and the health. After the treatment, the health you get back. the time you get back. Because when you get back the time, you have more energy to do other things. You don't waste your time ding dong here, ding dong there, looking for solutions.
Yes.
So actually the time is also money.
Yes. Yeah.
It's not only the medicines.
Yes.
And the time is very important.
Correct.
So if you can get back your health, let's say in 2 or 3 years, compared to 20 years,
yes,
it's a big difference, in times.
Yes.
So I mean, if I have friends in having this problem, I'll ask them to come to go through this kind of treatment,
yes,
instead of going through other ordinary treatments.
He is the only doctor to say can stop the medication. One day we can stop the medication.
Okay.
But other doctors say no, you can never ever stop the medication.
Because we always think that we can achieve that kind of things. I mean, get rid of the medicines. We can always, because you know the root cause, how to get rid of the root cause. Then you should be able to achieve it.
Yes.